head over to Saray. She's standing by with an important health alert on the facts and myths of mammograms.
That's right, an important topic. And I am here with Dr. Brett Parkinson, Intermountain Medical Center, Breast Care Center, to clear up some of the confusion about mammograms. And it is so confusing because what age are you supposed to get your first mammogram? That is a topic of contention.
You know, there are as many guidelines as there are medical organizations. It's very confusing. We continue to recommend that women begin annual screening mammography at the age of 40, and they continue for as long as they are healthy. But there are several organizations out there that have other recommendations that are really not backed up by the facts, and that's why at the Las Vegas meeting I talked about the myths of screening mammography, and really what we wanted to do was some myth busting.
So what were some of the myths that you talked about there in Vegas?
Well, the overriding myth is that the harms of screening mammography may outweigh the benefits in women under 50 or age 74. And that's simply nonsense because we have the results of multiple randomized control trials that show that the most lives saved occur in women when they begin screening at age 40 and they continue throughout their lives. We have to remember that 20% of breast cancers occur in women under the age of 50, and with every progressing decade of life, the risk goes up. So stopping at 74 is arbitrary, and not beginning until age 50 is actually foolish.
And then we also talk about how there's some guidelines saying don't do self-exams, and that you're saying no, because a lot of times that's how it's detected in the first place.
Right. About 40% of the breast cancers that we detect at the Breast Care Center come from women themselves or from their doctors when they discover a lump. So when you tell women not to examine their own breasts, or for doctors not to examine their breasts, then you're relying only on mammography, which is fine. Mammography does a really good job, but if you're not beginning until age 50, then how do we find the cancers under age 50, which is 20%?
And then another myth says, well, there are a lot of false positives.
Right. And the whole notion of false positive is really a misnomer because when we do 1,000 screening mammograms, about 100 women will be called back for additional tests. That's not a false positive. A false positive is when we say a test tells a woman that they have breast cancer and they don't. We're just calling women back for additional testing like an ultrasound or additional mammographic views. When push comes to shove and we do 1,000 screening mammograms, we find 5 women with breast cancers and we only have to do 15 biopsies. So you're looking at a false positive rate of not 10%, but 1.5%.
And the main takeaway is at age 40, every year get a mammogram and a 3D mammography, in fact.
Right. We know that the harms of mammography have actually decreased since we started doing 3D mammography because we call fewer women back for additional testing and we find more breast cancers and we find them at an earlier, more treatable stage. So absolutely begin annual screening mammography at the age of 40.
Dr. Parkinson, where can people find the most and accurate information?
I think if you go to the American College of Radiology website or to the American Cancer Society. The American Cancer Society begins screening mammography at age 45 definitely. And then they equivocate a little bit and they say, well,
40.
maybe 40. And if you do at age 40, then get it every other year, and you may transition every other year. But another big myth is that by doing it every other year, it's just as effective. Even the American Cancer Society itself and the United States Preventative Services Task Force says that if you do it every other year, you lose 20% of the mortality benefit of screening. So there are lots of myths out there, and our job is to dispel them.
Excellent. Always doing that and being such an advocate for breast exam and mammography. Thank you so much, Dr. Brett Parkinson with Intermountain Medical Center.